There are a number of inequalities in the world when it comes to socio-economic criteria and socio-economic parameters. But for me, as a person who has lived experience of mental disorders, mental health conditions, the existence of the mental health condition itself makes the world unequal. That's one of the biggest inequities in the world right now. I could even say that there is a mental health divide in the sense that there are people who have unimpaired mental health well-being, and then there are people like me who have impaired mental health. This creates a number of inequalities further down the line. One of them being the mental health literacy. Like certain people have awareness in literacy. Certain people do not have that awareness or mental health literacy. Certain people have access to mental health care. Certain people do not have access to mental health care. And there are certain people who are allies or companions on this path to recovery or living with the mental health condition. Whereas there are people who either are not allies or sometimes they are just downright cruel. So these are the various facets of mental health equality as far as I'm concerned. And this inequality is something we really need to bring down. Well, in the Indian context and even in the larger global context, we are all aware of the biopsychosocial determinants of mental health. And we all know that, the inequities, the inequality also contributes to causation of mental disorders and a little reduction in the well-being, the mental well-being of people. But for me, this whole area of mental health, this whole experience of having mental disorders itself has created a lot of inequity and inequality. Because someone like me who has a mental health condition, we have psychosocial disability, and this disability is invisible, people cannot see it. So just trying to validate your existence and just trying to validate the fact that you have a disability is really difficult, and that creates a lot of stress on people who are trying to get better, who are trying to recover, or who are just trying to live with these mental health conditions. When I had severe depression, I really found it very difficult to convince people that it's the disability is real. I really am not able to be functional and be the person I used to be before I got this condition. So a lot of my effort was spent on fighting the stigma, convincing people, getting allies for myself, and that was a part of the discrimination that someone with a mental health condition faces, because we are also human beings and we still go on and live a functional life despite being beset with mental health disability. In the workplace, there are people who do not have mental disability and there are people who have mental disability. Now, it's extremely difficult to convince people who do not have a mental health condition as to how it is that a person who has mental disability is able to manage their lives and what are the difficulties that they face in their day-to-day life. And in my experience, I have seen that most of the accommodation or any kind of leeway that is given to a person who has a mental health condition is mostly from a place of charity. It comes from the employer or the superior authorities in your workplace. It mostly comes from a place of charity that, okay, this person has a mental disorder and we should be kind to this person. I should not, further trigger this person. It's mostly that. And there's very little that comes from a place of right. It is usually not the case that someone who has mental disability also has rights. And given a little bit of accommodation around their disability can be really enabling. And these people like me also can perform as well as anyone else in the workplace. In the present times in India, we do have a really strong policy as well as legislative framework. We have the Mental Health Policy, we have the Mental Health Care Act, and we also have the Rights of People with Disabilities Act. So we are really in a good place as far as our policy and legislative framework is concerned. The only issue is that we need to raise awareness a little more amongst all stakeholders so that all these policies and the legislative framework is a little more impactful. And if we are able to effect that change, if we are able to create that awareness and the wherewithal in stakeholders to exercise their rights, to press for more impact, that would be the key, and that would perhaps really make these intended policy frameworks and the legislation even more effective, more impactful.